Somewhere in this video, I am going to tell you about a symptom that has nothing to do with your stomach, nothing to do with digestion, and nothing that most people would ever connect to cancer. A symptom so unexpected that when I describe it in my emergency department, patients look at me like I have said something impossible. Stay with me until we get there, because that symptom has walked people into my ER who had no idea what was actually happening inside their body. And for some of them, knowing it early enough changed everything. My name is Dr. Miles, 13 years in emergency medicine, and pancreatic cancer is the diagnosis I dread most when I am piecing together a patient's history in my department. Not because it is the most common cancer, because of what it does silently before anyone knows it is there. And because of how many times I have sat across from a patient and their family and watched the moment they realized the signs had been present for months. This video exists so that moment happens to fewer people. Drop a comment right now and tell me, did you know that pancreatic cancer can give warning signs months before diagnosis? Yes or no? I want to know before we start why this cancer is different from every other. The pancreas sits deep inside the abdomen, tucked behind the stomach, directly in front of the spine. Because of that hidden position, a tumor can grow on the pancreas for months, sometimes years, without creating any pressure, any pain, or any obvious sign that something is wrong. A patient can feel perfectly fine while a tumor is quietly growing, and a routine checkup will miss it entirely because the pancreas is not visible or palpable from the outside. This is not a failure of medicine. It is the nature of this specific cancer. By the time most people receive a diagnosis, the cancer has already reached stage 3 or stage 4. At that point, treatment options become severely limited and survival rates drop significantly. The 5-year survival rate for pancreatic cancer remains among the lowest of all major cancers. But here's what I need you to understand. There are warning signs. They are subtle. They appear in places most people never connect to the pancreas. And knowing them, really knowing them, is the difference between catching this early and catching it too late. I'm going to walk you through 10 of them. Some you will recognize. At least one will stop you completely. Let me tell you about a patient of mine that came to the ER. Robert Callahan, 57 years old, retired firefighter from Portland, Oregon. He came into my emergency department on a Tuesday morning with what he described as a pulled back muscle, dull gnawing ache in his upper back that had been building for 6 weeks. He had tried physiotherapy. He had tried anti-inflammatories. Nothing touched it. When I asked him about his appetite, he paused. He said he had not been hungry for about 2 months. He had lost around 14 pounds without trying and assumed it was stress after retirement. His wife mentioned that his eyes looked slightly yellow. He had not noticed. By the time we completed imaging, Robert had stage 3 pancreatic cancer. The back pain, the appetite loss, the weight loss, the jaundice in his eyes, every sign had been present for months. His body had been sending the alarm for 2 months before he walked through my doors. Robert's story is not unusual. It is the pattern. And the reason I tell it is this: not one of his symptoms on its own would send most people to an emergency department. But together they were telling a very clear story that nobody had read yet. That is what this video teaches you to read. Sign number 1, jaundice. Jaundice is a yellowing of the skin and the whites of the eyes. It is one of the most recognizable warning signs of pancreatic cancer and one of the most important to act on immediately. Here's what causes it. The pancreas sits directly next to the common bile duct, the channel that carries bile from the liver into the small intestine. When a tumor develops in the head of the pancreas, it presses against that duct and blocks the flow of bile. A substance called bilirubin that is normally processed and eliminated begins accumulating in the bloodstream. That accumulation is what turns the skin and eyes yellow. Jaundice from pancreatic cancer almost never arrives alone. It comes with dark urine that appears brown or cola-colored. Stools become pale, greasy, or clay-colored because bile is no longer reaching the intestines. These changes in urine and stool color are directly connected to the bile duct obstruction and should never be dismissed as a dietary issue. In my emergency department, jaundice, with dark urine and pale stools, is a combination that puts me on high alert immediately. Sign number 2, upper abdominal pain that radiates to the back. This is the symptom that brought Robert Callahan to my department, and it is one of the most consistently misread warning signs I encounter. As a pancreatic tumor grows, it presses against the surrounding organs and the network of nerves that runs directly behind the pancreas. That nerve involvement sends pain signals to the middle and upper back, a dull, gnawing ache that seems to wrap around from the front of the abdomen to the back. Two clinical details make this pain distinctive. It worsens after eating because digestion increases activity around the pancreas. And it worsens when lying flat because gravity shifts the tumor's position against the spine and surrounding nerves. Many patients find temporary relief by leaning forward or curling into a fetal position. That positional pattern is a clinical clue I take seriously every time I see it. Upper abdominal pain that radiates to the back, worsens after meals, and improves with forward leaning is not a pulled muscle. It deserves medical investigation. Sign number 3. Unexplained weight loss. Losing weight without changing diet or exercise is one of the most reliable red flags across multiple serious conditions. In pancreatic cancer, it happens through a specific mechanism. The pancreas produces the enzymes essential for breaking down fats, proteins, and carbohydrates. When a tumor interferes with enzyme production, food passes through the digestive system without being properly absorbed. The body is not extracting the calories and nutrients it needs, even if the person is eating normally. According to MD Anderson Cancer Center, losing 5% or more of body weight in a single month warrants serious investigation. For a person weighing 180 pounds, that is 9 pounds, gone in 30 days without trying. Cancer cells compound this by consuming enormous amounts of energy as they multiply and release inflammatory proteins that accelerate the breakdown of muscle and fat tissue. Most patients look back and realize the weight loss began months before their diagnosis. They attributed it to stress, aging, or a busier schedule. They were wrong. Sign number 4. Loss of appetite. This goes beyond occasionally not feeling hungry. People with pancreatic cancer often describe a complete disinterest in food, even meals they previously loved. The very thought of eating makes them uneasy. A growing tumor can physically press against the stomach, or the upper part of the small intestine, creating a sensation of fullness even when the stomach is nearly empty. But the appetite loss goes deeper than mechanical obstruction. Tumors release substances that interfere with the hypothalamus, the part of the brain responsible for hunger regulation, essentially turning down the body's desire for food at a neurological level. When appetite loss combines with unexplained weight loss, the two create a cycle that accelerates deterioration rapidly. If you or someone close to you has had a sustained loss of appetite for more than 2 weeks with no clear explanation, that combination warrants a doctor's visit without delay. Sign number 5. Nausea and vomiting consistently tied to meals. Nausea and vomiting are easy to dismiss as a stomach bug or food sensitivity. In pancreatic cancer, there's a specific mechanical reason behind them that makes them different. As a tumor grows, it can press against the junction where the stomach connects to the small intestine. When this passageway becomes partially blocked, food cannot move through efficiently. It sits in the stomach longer than it should, triggering nausea and sometimes vomiting of undigested food within 1 to 2 hours of eating. The pattern is the key clinical clue here. When nausea is consistently triggered by meals and accompanied by vomiting of undigested food, and particularly when it appears alongside weight loss or abdominal pain, it stops being a stomach bug. It becomes a pattern that requires investigation. Sign number 6. Changes in digestion and stool. Chronic digestive disruption, persistent diarrhea, constipation, or an unpredictable alternation between the two is a symptom most people attribute to stress, diet, or irritable bowel syndrome for months before anyone investigates further. In pancreatic cancer, this happens because the tumor blocks the pancreatic duct and prevents digestive enzymes from reaching the intestines. Fats in particular pass through the system, undigested, producing stools that are loose, oily, pale, and unusually foul-smelling. This condition is called steatorrhea, and it is a direct indicator that pancreatic function is significantly compromised. When chronic digestive changes appear alongside unexplained weight loss and appetite disruption, the combination is a pattern that should prompt immediate investigation of the pancreas. Sign number 7. Itching skin with no obvious cause. This is the symptom I promised you at the beginning of this video, the one that stops people cold when I explain what is behind it. Persistent, widespread itching of the skin with no rash, no allergic trigger, no obvious explanation can be one of the earliest signs of pancreatic cancer. And almost nobody connects it to their digestive system. The mechanism is the same as jaundice. When a tumor blocks the bile duct, bilirubin accumulates in the bloodstream and eventually deposits in the skin tissue. Once bilirubin reaches the skin, it triggers intense itching that no amount of scratching relieves. This itching frequently appears before the skin visibly turns yellow, meaning it can be the very first visible sign that something is wrong. I have seen patients spend weeks treating assumed allergies, changing laundry detergent, trying antihistamines, while bilirubin was building in their skin tissue, pointing directly at a bile duct obstruction. If you develop widespread persistent itching with no identifiable cause, especially alongside darker urine or any changes in stool color, do not treat it as an allergy. Get it investigated. Sign number 8. New-onset diabetes after 50 with no risk factors. This connection is one of the most important and most under-recognized warning signs in medicine. And in 13 years of emergency medicine, I have seen it missed repeatedly. The pancreas produces insulin, the hormone that regulates blood sugar. When a cancerous tumor grows within the pancreas, it can destroy the insulin-producing cells directly. Blood sugar rises. The patient develops diabetes, seemingly out of nowhere, with no family history, no significant weight gain, no obvious risk factors. Research has shown that new-onset diabetes has been identified in up to 30% of pancreatic cancer patients. 30%. That is not a minor association. That is a pattern significant enough that researchers are actively studying it as a potential early screening tool. There is a second variation of this sign that is equally important. People who already have well-controlled diabetes may experience a sudden unexplained spike in their blood sugar. Medication that worked perfectly for years becomes insufficient. Dosages have to be increased without a clear reason. If you are over 50, have no family history of diabetes, have not gained significant weight, and are suddenly diagnosed with diabetes, ask your doctor directly whether further investigation of the pancreas is warranted. That single question could lead to an early diagnosis. Sign number 9, an unexplained blood clot. Now, I want to tell you something that has a name, a history, and a level of clinical significance that most people never hear about outside a medical textbook. In the 1860s, a French physician named Armand Trousseau noticed a pattern. Patients developing unexplained blood clots, particularly in the legs with no obvious cause, were subsequently being diagnosed with internal cancers. He described this association in such detail that it became a named clinical phenomenon, Trousseau syndrome. The appearance of unexplained blood clots as the first sign of an underlying malignancy, particularly pancreatic cancer. Armand Trousseau later diagnosed himself with the same condition. He recognized the blood clot in his own arm as the sign he had spent his career documenting. He was right. In my emergency department, when a patient arrives with a deep vein thrombosis, swelling, pain, redness, and warmth in one leg, and they have no history of clotting disorders, no recent surgery, no prolonged immobility, my mind goes immediately to the question of occult malignancy. Pancreatic cancer is on that list. Pancreatic tumors release procoagulant substances that activate the body's clotting cascade directly. The clot is not coincidental. It is the cancer announcing itself in a language most people do not recognize. If you develop an unexplained blood clot with none of the common risk factors, your doctor should be investigating further than the clot itself. Sign number 10. Profound fatigue that does not respond to rest. This is the symptom most people normalize the longest, and it is the one I hear about most consistently when patients and families describe what the months before diagnosis looked like. This is not ordinary tiredness. Cancer-related fatigue is a deep, whole-body exhaustion, completely disproportionate to physical activity and completely unresponsive to rest. People describe feeling drained from the moment they wake up. Tasks that previously required minimal effort, walking to the car, preparing a meal, taking a shower, suddenly feel overwhelming. Several mechanisms drive this simultaneously. The tumor consumes a significant share of the body's energy resources as it grows. The immune system is working continuously, trying to contain the cancer, depleting energy reserves further. Nutrient malabsorption means the body is failing to extract calories from food, regardless of how much the person eats. The muscles and organs are running on empty. When fatigue is persistent, unexplained, and appearing alongside any combination of the other signs on this list, weight loss, appetite changes, abdominal discomfort, digestive disruption, it is not aging, it is not stressful. It is a signal that deserves to be taken seriously immediately. If you are watching this channel for the first time, subscribe right now and turn on notifications. What I share here is what I see from 13 years standing in emergency medicine. The patterns that arrive in my department, the signs that were present for months before anyone acted on them, and the information that should have reached people far earlier. That gap is why this channel exists. Subscribe so this information reaches you before it needs to. Pancreatic cancer is dangerous not because medicine cannot treat it, but because it hides. It sends signals in places no one thinks to look: in the skin, in blood sugar levels, in a blood clot in the leg, in an itch that will not quit. By the time the obvious signs arrive, the window for early intervention has often already closed. Robert Callahan spent 2 months attributing his symptoms to retirement stress and a pulled muscle. His body had been trying to tell him something the entire time. You now know what to listen for. Share this video with someone you care about, not tomorrow, today. Because the person who needs this information most is probably not the one watching right now. Drop a comment below and tell me which of these 10 signs surprised you most. And did any of them make you think of someone you know? I read every comment, and the patterns people share consistently remind me exactly why this information needs to be out here. Am Dr. Miles. 13 years in emergency medicine. Pancreatic cancer does not announce itself loudly. It whispers, and the people who hear the whisper early enough are the ones who know what sound to listen for. Thanks for watching. I will see you in the next one.